Hi, I'm Dr. Peter Callender. I'm an orthopedic surgeon who specializes in hip and knee replacement surgery here at California Pacific Medical Center. So who is a candidate for a knee replacement? Well, there's really two reasons why you would need a knee replacement. One, a lot of pain that doesn't go away. And two, you're having to really modify your activity. If you reach a point in your lifestyle where you have constant limitation in your activity and you can't keep up with your family and friends and having to require lots of pain meds and rehab and that all fails, then you may be looking at having your knee replaced. In your knee joint, the most common kind of cause of knee pain is arthritis. And arthritis is when the surfaces of the joint are worn away and they end up causing bone on bone. And when you walk on bone, that hurts. So we need to replace the surface of the joint. How do we do that? Well, with the knee surgery, we go in and we make an incision where we expose the bone that is causing the pain. And we make cuts on that bone to remove the area that's painful, the arthritis, and we replace it with an implant. It's a metal implant that resurfaces the ends of the bone that hurt. And then in between, we put a little bit of plastic and the joint will then move back and forth. Let me show you what a knee replacement looks like. So here is a knee joint, and you'll see here there is some metal, and the metal is placed on the end of the bone where it used to have a lot of arthritis. And then on the bottom is metal for the tibia or the lower leg bone. And then in between is plastic, and this allows for the knee joint to move back and forth like a normal knee. However, in this situation, you're moving back and forth on metal and plastic and not on arthritis, and that's what gets the pain to go away. We do the same with the kneecap. On the undersurface of the kneecap, we put a little plastic, so the plastic rubs on the metal as well, and this is what a knee replacement looks like. Our surgeons use a new technique, a new breakthrough really in knee replacement surgery, a patient-matched custom knee replacement. We make an implant that matches your knee. And this device that we use in the operating room really helps us to get you back to your normal lifestyle in a much quicker fashion. It's not uncommon for patients to begin use of stairs in 2 to 3 days and even return to work as early as 2 to 3 weeks. Well, let me compare the two types of techniques. Now, the standard knee replacement entails taking a large rod such as this and putting it into the knee. And why would I do that? Well, I would do that in order to have a perfect, or try to get a good alignment of the knee so that I can make these cuts on the end of the knee to place an implant. Well, as you can imagine, by putting something like this into the knee causes a lot of blood loss and a lot of invasive aspects to the procedure. And being this invasive is one reason why it can take a long time to recover. If we take the new technique, which is taking an MRI of your knee, this MRI really takes a custom look at your knee, and it shows the specific architecture of your knee. And we take that information with an X-ray that is taken from your hip to your foot, and we combine those two pieces of imagery and we put it into the computer. And the computer gives back a custom cutting jig. And this custom cutting jig looks something like this. Now, this custom cutting jig is used to make cuts. Instead of using a long metal rod into your knee like I showed you before, all I do is I take this custom jig and I place it onto the end of the bone like that. Now, as you can see, this is not very invasive, and it has a little slot in there where we can use our guide to make cuts on the knee, and by doing that, it's very minimally invasive. I'm not having to disrupt a lot of the tissue around it because I can kind of make a smaller approach and treating the tissue around it much more delicately, and so there's a lot less trauma to the knee with this approach. It's beneficial for a few reasons. One, it's less invasive. I'm actually able to make a smaller incision by using a smaller type of cutting jig on your knee. Number two, the operative time is much shorter. because I don't have to spend all this time with metal rods in your knee trying to decide the alignment and make the cuts just right. I can just place this on and we're done. And by having a shorter operative time and smaller incision and less trauma to your tissue, we also have a much better aligned knee, because if these cuts are designed by a computer, you know that the cuts are very specific. And by having the cuts very specific, the implants are placed in your knee just right so that they will articulate or move much more fluidly without rubbing away or causing wear. And the benefit of that is that the implant lasts a lot longer. I'm Dr. Peter Callender, and now you know.